So tell us a little bit about innovative solutions, and Sedera is one of those. Tell us a little bit of the history of Sedera and what Sedera is.
To describe that history, I would have to start and give credit where credit is due. And that is that the basic concepts of what we now call medical cost sharing grew up among the Christian healthcare sharing ministries. And going back, actually, I think it was to 1981, the first of these groups, the Christian Brotherhood, and then subsequently in the early 90s, groups like Samaritan Ministries or MediShare began. These groups said, at its simplest, that the Bible teaches an approach to life where it was said of the early Christians that there were no needs among them because whenever any had needs, they shared.
Mhm.
And so they literally grabbed that language and they said, why don't we do, for example, what the Amish from a religious background have done? Instead of, the Amish, instead of insuring buildings, and if a fire came and the church building got burned down, what did they do? Well, they didn't ask an insurance company to bail them out. They said, hey, community, let's come together and let's rebuild it. And they just rebuilt it out of their pockets. Now, that's a relatively simple and very, very rare circumstance to have, a building burned down. It's actually a circumstance where insurance works remarkably well.
Mhm.
But when you move to a very common situation, the question is, could that sharing model work? And what these Christian groups demonstrated was yes, you can take that innate desire for community, the trust that we can have between each other, and you can build that on a sort of financial and technological model in such a way that you can give people an effective way to deal with the large medical bills that people might experience from time to time. Now, having worked with those ministries to help them understand more about how to negotiate their bills and have fair pricing and all of this, obviously I had observed over many years, over pretty much a 15-year period leading up to the Affordable Care Act, what they were doing. But I'd also been doing similar work for many of the insurance companies, because in those days, there were limited medical benefit products and, products that were just for short term and all sorts of things that, sadly were sort of outlawed by the Affordable Care Act.
Right.
And so, as the government tried to mandate and narrow down to what could only be handled by a few mega corporations that, of course, were delighted to get whatever extra business the government was going to give them, especially based upon the concept of a medical loss ratio where their profits were limited to a certain percentage. So what do? Let's just keep putting up the premium cost. And then what we're earning year by year grows automatically. That there are such simple principles involved here. But, seeing these things, I actually tried over a pretty extensive period of time, a couple of years, meeting with some of the leaders within the Christian healthcare sharing ministries and encouraged them to let's open this up to anybody and everybody. But by then they were protected by the Affordable Care Act. And the trouble with government protection is it looks so nice. But if the government can give you that protection, they can take it away.
Yeah.
And, as I looked at this, I just said, but surely as Christians, isn't your call to the world? Don't you have a responsibility? If you've got something good, aren't you going to give it away? But I guess I'm kind of naive and idealistic. And, when they already had something very valuable to lose if it didn't work, and with an exemption that was based on the fact that they would only work with active evangelical Christians who could sign their faith statements, I guess what I was saying sounded crazy. But I just felt, no, we have an obligation to this great country that has given all of us so much. If we've got a good idea, and the country is going bankrupt because of healthcare, then we have every obligation to share it with the nation. And so I began thinking and researching, how can we take, and so that was the foundation in the thinking of Sedera. And obviously, as a high-tech solution in the middle, sort of somewhere in between banking and insurance in most people's minds, and borrowing from the sharing economy, learning from Uber and Airbnb and others in terms of what they're doing. Yes, this is a very complex and highly regulated environment, but it's also a very wonderful environment because it's an environment that is absolutely ripe for disruption.
Yeah.
Everybody has a pain story tied up with the healthcare system. Everybody knows someone personally who's been hurt, not often medically, although sometimes that's the case, but everybody knows someone who's been hurt financially.